So we started to have a conversation about back. Okay, and then the doctor started to educate us about the spinal cord. So he was telling us the way each spinal session. Okay, this the bone holds a section of your body. So there's a part that holds from your back, okay, and the one that goes down to your lower waist. There's a curve that needs to be there. It's natural. So if somebody tells you your spinal cord has to be very straight, like a ruler, is wrong. That's much I know. And so today we're going to get into back pain again. We went to the streets and we asked a few questions. We'd play that back so that you have an idea of what people are also thinking. But when we're talking about pain, we're talking about medicals and all of that. From the Bank Hospital, we have the doctor, Dr. Wisdom. Good morning.
Good morning.
I like your smile.
Thank you.
Yeah, it doesn't make my back ache
and
at all.
I like your outfit as well.
Thank you. Thank you. Well. So last week we delved into back pain, and we're talking about. I think we started with posture.
Yeah.
Right? Yeah. And before even treatments and all of that would come. You want to give us a little recap, or?
I think you did a good job with a brief recap.
Trust me, baby.
It gets better every day.
Yeah, right. Okay. So because I've already done that, how about we take a take a look at that video, right?
Yeah.
What do you do when you have backache?
My name is Matthew.
I'm Blessing Labi.
Ruben Apia.
I'm Gosu Akotokwabena. Enoch Awule.
My name is Frank.
Such issues, I go to the pharmacy to get a painkiller to deal with it. You treat back pains with Abonike or Rob or something like that. That's how you usually treat Rob.
I usually treat back pain by getting Aboliki or what, an ointment to treat it. But if it gets what severe, then I go towards the hospital.
Oh, back pain, no. Actually, is there because of our daily activity. But I actually treat my back pain with ointment.
When the pain is very mild, I go with Aboniki or Agana Balm. But if it is excruciating, then I have to go with deep heat. So I think that the very cause of back pain it has to do with the way we sit. So see, chairs that do not have, let's say, a support, chairs that doesn't support our back, chair that doesn't support our back actually causes backward pain. That is the root origin for back pain. But I feel like if as a Ghanaian, if you have to sit, you need to sit on a chair that can support your back to protect your vertebral column. So I will actually aid or plead with all Ghanaians that whenever they are sitting, they should sit in a way that the chair can support their back.
It's not everybody who is privileged to have a forklift or all these machineries.
Yeah.
How do they do it so that it doesn't affect their back?
Yeah. So what most people do when lifting up heavy objects is that they bend their waists.
All the way back like that?
To pick it up,
And it's wrong?
It's very wrong because that puts, I told you how the spine was curved.
Yeah.
So that puts some tension on the spine, and that causes back pain. Can even cause a slip disc, In fact, actually, that's the most common cause of a slip disc.
Okay.
You see the cushions I mentioned in between the bones. One of it could slip, and then compress on the spinal cord, and that could cause back pain. And that's because of, and for most of that, you hear that when you're taking the history, they will tell you that, oh, doctor, I just got down to pick something and I heard a sound, bah. Aha, that there's something wrong somewhere. Sports diagnosis. Yeah, but the right way to pick things up is to flex or bend your knee and go down. You see the way the ladies do it?
Yeah, like when we drop something,
Yeah.
like excuse
The
me,
way the
drop
ladies
something,
do
just go
it,
down
that
and
is the
pick it.
right way to go down to pick
Oh,
something.
so it's not because our dresses are short.
No.
It's because we know what time it is.
That's the
I
right
see.
way to.
So
you know.
lifting heavy objects.
Yeah, so you see the way the person did it in the image you see in your
Yeah.
screen, that is wrong.
It's
So you
bad.
don't bend your waist.
Okay.
You rather flex your knee or bend your knee to go down.
But this posture is mostly seen in the gym.
Which of them?
The lifting. So when you go to the
Mm-hmm.
gym and you're lifting a weight, you can go all the way down like that and come up.
So
probably
you'd
with
realize
the
that
squats.
with that, most of the time, the focus is not on the back. They are rather exercising the arm, the upper
Yeah,
arm. So it's
yeah.
either they are suspending and then they are. So the weight of whatever they are lifting
Okay.
is at the. That's why there's a particular position the trainers will ask you to put your hand
All right.
before you lift.
So
if you
that
do
your
it
back
wrongly,
doesn't hurt.
the tension goes to your back and not
Great.
your upper arm. So if you're doing an exercise like that, it goes to your arm, your biceps, and your tricep. That's where the focus is.
Okay.
Yeah,
okay,
even when you
great.
are pulling, there's certain times that they pull. Yeah, so it goes. The focus is not going to the waist; it's rather going to the arm.
Great, great.
Right.
So heavy lifting and trauma, where that image is quite confusing.
Yeah, so basically when you have an accident, or let's say you fall, there are certain people that are prone to falls, especially the elderlies. They
Yeah.
are prone to fall. Maybe those with chronic conditions, those who have bad eyesight, and they can easily trip and fall. Even people who without condition, who maybe there's water on the floor and you slip and then you can fall. So basically that can also cause back pain. So you see the good technique, bending your knee to pick up, right? And then the wrong technique, bending your waist to pick up. With that, your disc will slip quickly, and then, especially if what you are picking is very heavy, and if it's something that you do often, more often, so it's totally wrong.
Real quick, Doc, some of us ladies, now we wear waist trainers, we're going to the gym, we're in a waist trainer very tight. I know some ladies who will sleep with that waist trainer, they put it around. And then some of the girdles that we wear beneath our clothes, there are some that have come, you have to take it all
the corset.
The corset, thank you very much. Yeah, and then we wear that, we're not comfortable. Don't tell us that, don't ask us difficult things. We just want to look very snatched. The body we don't have. Does that have any effect on our back?
So when it comes to waist trainers, I think that the focus is rather on the tummy, on the tummy. So I would be worried about you being able to breathe and breathe properly.
Okay.
And then, so the main focus is the tummy. It doesn't really affect. But then again, because you'll be tensioning the muscle, if it's so tight that I mentioned that when the muscle is tensioned, it can cause back pain, right? And so that's why even some people can say stress causes back pain.
Right.
That's not because there's a direct link, but because when you are stressed, your muscle becomes tensed. And then that tension can pull on the bones. I told you on Tuesday how the muscles hold the bones and the other structures, the ligaments, tendons, and all that. Now, when the muscle is tensed, it contracts and it pulls on the bone, and that can cause back pain, right?
Okay.
So that's the reason why when someone is stressed, if you realize I think even Nigerian movies and all that, they give a neck massage and then you tend to be fine. Why does that happen? Because your muscle is tense. So when they massage you, you tend to relax the muscle and then you tend to feel better. So you see. So corset can cause the muscles to be tensed because you're putting it in a particular position for over a period of time, and that tension can gradually pull the muscles will pull on the bones, and that can cause back pain. So it's not something you should be doing for a long period of time. I know people do that for weddings, right? People do it every day. Wow, you should tell me.
Some people wake up with it and go to bed with it because they want to be snatched. They want their waist to be smaller. Sometimes you see the physical thing. I'm quite worried about how it looks.
But there are times where a physiotherapist would prescribe a back corset for you.
Yes.
There are times where it's prescribed maybe for correction of maybe scoliosis or something, but there are specific times where it's prescribed. And then again, because people see those with back problems wearing corset, everybody thinks that when I have a back pain, it's equal to wearing corset, and then they go get any corset.
And
It's
wear
wrong.
double.
Yes, it's wrong because now it puts your back in a particular position if you are not careful. I told you the spine has to be curved in a certain
Yeah.
way. Now, if you are engraved in that straight corset, now you are telling your spine to become straight. Do you understand?
Yeah.
So if it's prescribed by a physiotherapist, and before they do that, they will have to do a scan, maybe an X-ray, an imaging of your back, or an MRI to see exactly, you know, what exactly is going on, to know that, okay, this is indicated for a corset. They are the experts in that field, so they will be able to tell you about that.
I see. Wow. So lifting heavy objects,
Yeah.
posture,
Yeah.
which means that employers must provide employees
With ergonomic chairs.
With what?
Ergonomic chairs.
Good.
Yeah.
Good chairs.
Yeah. So those chairs have, you know, the curvature at the back that's supposed to support the normal curvature of the spine.
Right.
Yeah, so other people would say if you are driving, put a pillow behind your lower back. So you are trying to mimic an ergonomic chair.
Ergonomic
right?
chair.
Ergonomic chair, yeah, trying to mimic that. So
I could have said economic chair. Economic chair.
yeah,
Right.
so try to sit in an ergonomic chair. And like we mentioned the last time, if you sit for a long period of time, try and get up, and stretch. Let your muscle relax, you know, and all that. Yeah.
Okay, let's scratch the surface of treatment before we go.
Yes, but before that, not so people don't think that, you know, posture and all that are the only causes of back pain.
Right.
I mentioned that the causes are enormous. The last time I highlighted that we have mechanical causes and medical causes. We've not explored that yet. Now, for the mechanical cause, we've only mentioned the muscle sprain.
Oh.
And that's because that's the commonest cause, you know,
Really?
of back pain. But there are other causes. You have degenerative causes. Degenerative causes mean that as you age, your bones, you know, start to become weakened. Your joints start to become weakened. So it comes with age. So it becomes weakened, and that can result to pain. And I also mentioned the slipped disc, you know,
Yes.
the one that your disc can be slipped. There's another one called the spinal canal stenosis. So I mentioned that there's a spinal canal within the vertebral column.
Yes.
Where
remember
it
that.
brings nerves from your brain, and as it descends, it tends to distribute. Now, anything that would cause that canal to reduce, in the lumen of that canal to reduce, would cause back pain, because the spinal cord needs room to operate. So if you are reducing their space, then you are going to
What
cause...
would ever cause that to reduce?
So many things. So even that slip disc can go and reduce the space, can impinge on the nerve, right? So many things. So wrong postures as well can also. So there are so many things that can result to your canal being stenosed. And then when we do an MRI, then we can see that, no, this is your canal. It will show on the image. And then you realize that at some point at your lower back, it has become, you know, like reduced in volume. So that can cause back. So that's it for the mechanical causes. Now, there are medical causes of back pain.
Childbirth?
So pregnancy is one of them. Not necessarily childbirth, but pregnancy. And that's because, you know, you are carrying a heavy, sometimes 2.5 kilos
Oh my God.
of a child, you know.
A woman.
I know, right? So that heaviness, you know, tend to cause back pain. And that can be equated, you know, inferring from that can be equated to ladies who wear heels. You know, when you wear heels, you tend to put a lot of stress. The focus now, you know, the body stands, and then you're under gravity. That's when your spine holds your body. So if you are wearing heels, it means you are tilting your body towards the front. So that energy goes towards the front, and that can result to back pain. So that in a way can also cause back pain. But for the medical causes, for the medical causes, they are, I mentioned the last time, if you remember, that as the spine goes from the neck down, the name changes, right?
Yes.
So we have the cervical spine, we have the thoracic spine, then we have the abdominal, the spine that houses the abdomen, right? The thoracic spine, the one behind the abdomen, right? So now, what happens is any organ within, that's the lumbar vertebrae, any organ within the abdominal cavity can cause a referred pain to the back. So the pain is actually coming from the abdomen, but it's a referred pain, i.e. problem with the kidney. So if you have a kidney stone, You may have a referred pain to the back. If you have an infection of the kidney, or called pyelonephritis, they will come with back pain. But it's an infection. But they are coming with back pain. So that's the reason why we say that always present if you have back pain, you know. So if you come with pyelonephritis, you present with a back pain. If you come with acute pancreatitis, so your pancreas, you know, becomes inflamed, it would present with severe back pain. So you feel the pain at the back. So it's a history taking, you know, asking you when it started, how it started, is it sharp, what's the character, the onset, you know, those questions that we ask will help us ascertain that, okay, this pain is coming from something else.
Does the size of the spleen affect, or if your spleen is inflated or anything, affect your back pain?
No,
also?
the spleen, the size of the spleen would not cause a back pain.
Okay.
Yes, when the spleen is, you know, enlarged, we're thinking of something else.
Yeah.
Maybe some hematological malignancy, maybe a blood cancer, or so many other things can cause your spleen to be enlarged.
But that
right?
doesn't affect the back.
It would not
does it?
necessarily cause a back pain, right? So kidney infection can cause a back pain.
Right.
Pancreatitis, acute pancreatitis can cause a back pain. There's something we call AAA, so abdominal aortic aneurysm.
Abdominal
Aortic aneurysm. So the blood vessel, the big blood vessel, the big artery in your abdomen that carries blood to your, that distributes blood from your heart, right? Now there are layers in that blood vessels. So it could split and then blood would move to another layer. So it's called an aneurysm. So you could have, it's like looking like you have two blood vessels, meanwhile it's just one.
One.
Yeah, so when that's is inflamed and it even gets to the point where it ruptures, it breaks out, it's an emergency. And they will present with severe back pain. Do you understand? So that's why we shouldn't take back pain for granted at all, because it's not all back pain that a Boniki would solve.
Right. I mean, we saw that from the video.
Yeah.
How about we pick some calls? We'll pick your call, just you that you're watching, just your call. So you can call, numbers on the screen, call us and tell us, or ask any question at all. Just probably one or two calls and then we can go. Right. So we're dealing with medical causes of back pain, right?
Yeah.
Have you?
Yeah, so I think that's it. I didn't mention arthritis. Some people tend to have arthritis. We have, rheumatoid arthritis, osteoarthritis. These can cause back pain, you know. Someone might want to ask, is back pain hereditary? Can I get back pain from my parents, you know? So, you'll be shocked.
I mean.
So you would not necessarily get back pain from your parents. It's not necessarily hereditary, right? But the condition that would cause back pain is hereditary. So arthritis is a hereditary condition. So if your parent had arthritis, it's likely that you can also develop arthritis. So that can cause back pain. Not that you have inherited a back pain. It's like saying,
in our family we have back pain.
Inherited fever. My father had fever, high temperature. So all our siblings, we all have high temperature. So how can you inherit?
Oh my God. I want to be in the consulting room just one day
It's
and
amazing.
enjoy that. Wow. Okay. So then the back pain is not hereditary, but if you have underlying conditions
that are hereditary and predispose you to back pain,
then you have the same thing.
The same thing. Yeah.
I see. So that exhausts us for the medical, right?
Yeah,
okay. So now let's use like a minute to deal with treatment from home before we get to the hospital. So
when it comes to treatment of back pain, it is not news that the general public resort to OTC medications, right? And then they run to NSAIDs.
OTC?
We call them over-the-counter.
Oh.
So medications that are not prescribed by the doctor. So you just go to a pharmacy and you purchase. So most people do that already, even before coming.
So my caller, Cynthia, see, we're talking to Cynthia the whole time. Hi, Cynthia.
Hello.
Morning. Great. Talk to us.
Okay. Good morning, Doctor. You too.
Good morning.
To find out, I've had this back pain ever since I gave birth to my son. I had a CS with him, and ever since that day, and it's been 5 years now, it's my lower back and then it's been causing me pain constantly. I just wanted to find out if it's as a result of the CS. That's why the back pain keeps continuing, or there's something else wrong. Thank you.
Yeah, doctor.
Yeah, I think it's a good question because most women, some women, not most women, some women tend to have back pain after cesarean section delivery, and that can be, and that's after we've ruled out every other cause of back pain. Most of the time it's attributed to the spinal anesthesia. Okay. So I'm sure she's off the line, but if you get to ask her, she'll tell you that she was given anesthesia through the spine. And that is actually one of the, one of the causes that we even explained to you, before, part of the anesthesia preparation before surgery, that, these are some of the things that could happen, but then we can manage them, right? So when you've had a spinal anesthesia, not everyone tends to have that prolonged back pain, but it's a back pain that it's not a sharp pain. It's a pain that will be dull, and it will be intermittent. Okay. So for a period, you are without back pain, and then it comes, it's like on and off and all that. So unfortunately, some women tend to develop that as a result of the one of the causes of spinal anesthesia. So we're going to have to put a
pause on that. Hello, Abdul.
Good morning, madam.
Morning. Talk to us.
Okay. Greetings to my best doctor, my handsome doctor too. Please, I want to find out something small. I don't know, when you sleep and you wake up, sometimes you be feeling back pain, those kind of stuff. So I would like my favorite and handsome doctor to explain the causes of the back pain after sleeping when you wake up from the bed. This has been one of the tedious questions, and my handsome doctor is in position to respond to it.
Handsome doctor, please. Talk to us. I spoke about posture, right? Yeah. I mean, because we don't know how we look when we sleep. Yeah. But sometimes we just wake up with back pain.
Yeah. So now let me take it in two angles.
Great.
The first angle is if you sleep and wake up with a back pain, that is a red flag. You're certain back pains, normal back pains are supposed to resolve with rest. Now, if you are done resting and you are rather having that big back, you should go to the hospital. Now, the second aspect is if you slept in the wrong posture, you will get a back pain.
Right.
Yeah, so sleeping in the right posture is sleeping on your side and then with a pillow in between your legs.
Wait, would have to do that education. I need it. I'm going to be selfish with that. But Sophia, good morning.
Good morning.
Morning. All right, we can hear you, please.
Yeah, I'm having this back pain for a while now. And sometimes, I'm a seamstress. So sometimes, if the pain is severe, I have to get up, raise my two hands up, then I bend myself down. Then I'll hear some noise that my bones, as my back pain, is it the bones, are they opening, or I don't understand. Then the pain will go down small. Sometimes I have to lie down for my child to step at my back, then I'll be relieved. So I don't know, but it's continuing. So I want to tell Doc that what is wrong with my back.
Okay. Right. I can easily, on top of my head, say because she sits down
for a long time.
I see. But what else? Let's hear from the handsome doctor.
Yeah, so the moment she mentions she's a seamstress, that's like a light bulb moment, obviously, you're sitting for a long time. And so what she's doing is the right thing. So she realized that she gets relieved when she tends to get up and stretch. And on Tuesday, if you remember, I mentioned that when you tend to sit for a long time, take breaks. And it should be intentional. You don't even have to feel the back pain before you take those breaks.
Right.
So what she's doing is she gets the back pain, then she takes those breaks. So she should be, spontaneous. Let's say maybe after an hour, after 2 hours, and you just get up and do that stretching she spoke about, and then go back. So you realize that the whole day you would not even wait to feel the pain.
But this is
before.
a lifetime job.
Yeah.
Right? And so does it mean that every time you have to be doing this, is there any special therapy or something they have to go to probably fix their back because of what they do?
So if there is no underlying cause to her back pain, and it's as a result of the strain I spoke about, then getting an ergonomic chair whilst doing your job should help.
Okay.
You know, whilst still maintaining the regular
getting up.
Yeah, getting up. It's not. Preventive measures are better than treatments. So would you prefer to sit down for 20 hours and then develop a serious back pain? Now you have to do surgery. You see, so take those breaks in between and get up. Yeah. Okay,
so it's time. We have to go. But why not drop your comments on our socials? The doctor would surely deal with all the issues that come up. So like, share, drop comments, get on My Dominion TV, and then send all your comments. There's a back pain, spine, hospital or something? Spine clinic.
Yeah, spine awareness camp. But before that, I wanted to highlight red flags.
Red flags. It's not only in relationships.
Here without highlighting red flags, to be a disservice to my viewers and to the medical community out there.
I see. So, okay, so let's take Najeli's call. Ajeli, we love you, so just speak up. Hello, Ajeli. Oh,
you lost her.
Okay, let's get the red flag.
So
not in love.
If you are looking at back pain and you have associated symptoms like a fever, night sweats, weight loss, please don't go for aboniki, don't go for painkillers, go to the hospital. Right. So these are signs that we need to look out for. We want to ensure that we are not missing out on any cancer here. Right. Now, if you also have a back pain that radiates to your buttocks and then to your thigh, to your legs, please go to the hospital. We want to ensure you're not missing out on sciatica here, sciatic nerve, one of the longest nerves in the lower limb, right? If you are having a back pain, I mentioned fever, night sweat, weight loss. Now, the next one is if you're having a back pain with neurological symptoms, you're not able to control your bowel, you're not able to control your bladder, so you just urinate at any time without even feeling it is coming. Please, it's called a saddle and it's paresthesia. So you have maybe numbness around your perineum, your groin area, even to your butt, your buttocks, you have numbness or a tingling sensation. It's a red flag for you to go to the hospital, or else you're at risk of losing your limbs. You'll be there and you're not able to walk again because maybe the nerves are telling you that they are in trouble and you're not paying attention to that. And then if you sever the nerve, then you're not able to walk again, because I told you it controls everything down there. So yes, those red flags are important.
Okay, I think that you should follow us on our socials, because we're going to cut these red flags and keep posting them. You need to pay attention to your back. When your back was against the wall, the Lord came through for you. So you need to come through for your own back, okay? All right, so this has been Health Matters with me, Biadola. Let's go for a break, and then when we get back, the Wake Up Africa show continues.